covering all things diabetes in the last 1 month. I'm Anushka. I cover health here at Quint Fit and the Quint. And I'm thrilled to introduce our guest for today, Dr. Ambrish Mithal. Hi. Thank you so much for joining us today. Dr. Mithal is an endocrinologist and a diabetologist, and he's the head of diabetology at Max Hospital, Delhi. And he's very kindly joined us here today. If you have been following QuintFit, you might have seen the short videos that he's been doing for us in the last few weeks, covering diabetes management, myths, diet, and so much more. But he's here in person today to answer your questions. So if you have any questions for him related to diabetes, please put it in the comment box and we'll take it through the course of this session. While we wait for people to trickle in, shall we begin with some, say, basic questions that people have? First of all, let's start with what should the normal range of blood sugar be for a regular, healthy human adult?
First of all, thank you, Anushka, for having me here in this lovely office with such a nice view. So when we talk of normal blood glucose level, a fasting of 100 or less is considered normal, and a post-glucose, 2 hours post-glucose of 140 or less is considered normal.
Okay.
So this is like completely normal blood glucose. And then to diagnose diabetes, you need to have a fasting of 126. We're talking of milligram per dl here. And a post-glucose 2 hours of 200 or more. So 126, 200, 100, 140. But that leaves something in between. What happens to those whose blood glucose is 110, 115? So if you're between 100 and 126, then, or if your post-glucose 2 hours is between 140 and 199, then you are called pre-diabetic. So there's diabetes with all its attendant complications, and there's completely normal, and there's a huge chunk of people who fall in the pre-diabetes.
So I do want to come to pre-diabetes in just a bit.
Yes.
But before then, we have some questions that our readers have sent in via email. So let's start with that, and then we can take the questions that come in the YouTube section. So the first question is, can you do intermittent fasting if you are diabetic? And if you want to do it, are there any do's and don'ts to follow?
So I think that's a very common question these days. And intermittent fasting has become a rage now. So we are not against or for intermittent fasting. There's nothing wrong in doing it if you want to do it. But there are certain caveats. Only people with diabetes who are either on just diet control or those who are on drugs like metformin or the drugs we call gliptins, the DPP-4 inhibitors, or drugs like SGLT2 inhibitors. So drugs that do not cause a drop in blood glucose. If you're on any of those drugs and check with your doctor, then there's really nothing wrong in practicing intermittent fasting. And I presume you're referring to 16 and 8, right? 16 hours of not eating and 8 hours of eating. So in that sense, yes, it is possible. But if you have, more complicated diabetes, if you're on drugs that can produce low blood sugar, like sulfonylureas or insulin, or you have other issues like kidney issues, liver issues, heart issues, then I would not recommend intermittent fasting. In fact, if you're on insulin or sulfonylureas, it can be quite dangerous to go without food for 16 hours. So yes, you can practice intermittent fasting. If you're in that zone, please check with your doctor. Don't do it randomly. And there are two other important points about this. People think that when you're in an intermittent fasting program, you can eat anything in the 8 hours that you're allowed to eat, which is how people advertise it. But truly speaking, if you're a diabetic or even otherwise, if you're doing IF to lose weight, it's good to have relatively healthy food and not stuff yourself in the 8 hours that you have to eat. I think that's important. So, those are the basic principles of intermittent fasting. If you have, of course, a lot of acidity and other things, you probably don't want to, be starving for 16 hours. That also won't work. Another common mistake that people make in intermittent fasting is that they tend to miss breakfast. busy young crowd of today, people with diabetes, pre-diabetes, etc., they think they can practice intermittent fasting by missing the first half of the day and stuffing yourself in the second half. So while that is also intermittent fasting and it is practiced by some, if you have a choice, you have to follow the body's rhythm, the nature's rhythm. And that is you have your breakfast and lunch. You can delay your breakfast if you like and avoid dinner. So that is better not to eat late at night or late evening rather than not to eat in the morning and eat at night. Although even that will work, but this one is a better proposition.
Another question that we have from one of our readers is, does diabetes make one more prone to fungal infections or other skin infections? And if yes, what can help?
So, yes, diabetes does make you more prone to infections of all kinds. And definitely fungal infections, skin infections, mucosal infections. What can you do? Keep your diabetes under control. If diabetes is well controlled, if your blood glucose values are at the target that has been prescribed by your doctor, then your risk is nothing. So the key point here is to keep the blood glucose under control and your risk for infections drops drastically.
And this is a more basic question, and I'm sure a lot of people have this question. What kind of precautions need to be taken in your daily life if you're a patient of diabetes?
Oh, that's a long list, Anushka. But basically, living with diabetes means living healthy. So there's really nothing that we expect people with diabetes to do that we do not expect anyone else to do. Basically, it's about that. So you have to watch your diet. You have to make sure you're avoiding refined carbohydrates. Add fiber to your meal. Add protein to your meal. So make sure that you are having a healthy diet. And as I said, in urban Indian diet, especially, refined carbohydrates are the biggest problem. After that, lack of fiber, lack of protein. And the third, of course, is excess of fried food. So those have to be avoided. You must ensure that you are physically active. If you're not able to do structured exercise, which is actually preferable, then at least increase your activity, take the stairs, walk everywhere in the office. Don't plonking yourself in a chair is probably not the best thing to do. We should get up every half an hour or so at least. If you have a job like that which makes you sit on your chair all day, please get up every half an hour to say hi to a friend or just make a call or do something. I think it's a good idea. So, of course, if you add structured exercise, about 40-45 minutes daily of physical activity, that will be fantastic. It can start with brisk walks, it can be yoga, it can be aerobics, and a little bit of strength training also helps a lot because strength training improves insulin resistance. So, diet, exercise, sleep. Sleep is exceedingly important. And I think we sometimes ignore the importance of sleep in managing our day-to-day health as well as diabetes. So therefore, adequate sleep is important. Typically 7 hours, we say, but certainly not less than 6 hours. Right?
But I'm also wondering, are there any exercises that you shouldn't be doing if you're diabetic or severely diabetic?
So that's a very good question. Exercises in diabetes, actually, diabetes per se is not a reason to change your exercise plan. But having said that, if you're a diabetic and you have retinal problems, if you're a complicated diabetic, you need to check with your doctor what you can do, what you cannot do, especially if you've had a retinal detachment or a bleed. So that's that. Then if you have, of course, if you have uncontrolled blood pressure along with diabetes, then also you have to check. If you have a cardiac condition, obviously you will check with your doctor what you can do and what you cannot. And lastly, if you have neuropathy, if you have problems with the nerves, especially of the feet, because you're going to exercise on your feet and the sensation may be impaired, so you need to take adequate precaution. But as such, blood glucose per se is not a contraindication to any exercise.
Right. And this is an interesting question that we've got. Are there any desi nuskas that work in treating or controlling diabetes, like having soaked methi water or flaxseed on empty stomach?
So things like soaked methi water and flaxseed are all good things. They give you something or the other. Flax seeds do give you a lot of antioxidants. So these are healthy additives to our diet plan. But they're not really going to bring down your blood glucose. If you think they are, they're going to lower your glucose. That's very unlikely. But it's okay to have them because they give you good stuff. They give you antioxidants, minerals, vitamins. Good, go ahead. But not in the hope of substituting your medication or really bringing your blood glucose down. So I encourage all these, but again, continue with your medication as advised.
Another reader asks, my father is diabetic and his doctor told him to always eat a tad bit less than his appetite. What is the logic behind this?
So it's not just for diabetes, for anyone to eat healthy. Okay. If you stuff yourself, it's not going to help, because all your metabolism then gets focused here. So, and it's always possible to meet all our nutritional requirements by eating little less than when feeling absolutely full. So when we are children, we are often taught to stuff ourselves, but probably it's not the best thing to do. So yes, it is good to leave a little bit of space in your tummy when you are eating, if you have diabetes or even otherwise. And that's obviously so that you'll consume less. It's not to do with diabetes, just reducing your calorie intake.
Okay. So we have another question from the chat box. What are some common foods that can shoot up your blood sugar levels? So, apart from the obvious.
Yes. So I recently had a patient who's had diabetes for 25 years and seeing me for 25 years. And he came to the office and just kept his file down. I said, wow, Mr. Chopra, your results are very good. He says, yes, but I know. But I've discovered what it was. Every time I eat sweet, my sugar goes up. So I said it took 25 years to discover that. So obviously, anything that tastes sweet is not healthy. It'll spike your sugar. But there's a lot of hidden sugar that we forget. Like people do not think of white bread as sweet, but white bread is as bad as having chini. Okay? Maida. Anything done with maida is terrible for us. So all these things will send your sugar spiking. Obviously, then cakes, pastries, all those things will spike your sugar. Mithai, all the beautiful things of life, the delicious sweets that you have on festivals, they are definitely going to raise your sugar. In addition, of course, one has to be careful even with fruits. While fruits are generally healthy, and we do advocate eating fruits, but the amount has to be controlled. Otherwise, there can be a sugar spike even after fruits. So I think those are important areas. Soft drinks. People forget how important these colas and these orange drinks, etc. are. People think they are fruit. Some of them think fruit juices are natural. And what's wrong? It says contains no added sugar. I mean, you don't need to add sugar. It is full of sugar. Sometimes people ask me, you say we can have a fruit, but we can't have fruit juice. Why is that? So just think coolly. When you're having a fruit, you're having a lot of fiber with it, right? Along with the sweet, so that sort of delays the absorption, keeps it in the stomach. When you're having a juice, then you're having just the extract. The mineral, much of the minerals are left behind. It's just sugar. So that's why juice is not the preferred mode. And also remember, if you have an orange, maybe, but how many oranges does it take to make a glass of orange juice? Not one orange. So you're taking much more. So all those things we need to be careful about.
And speaking of food, we have a related question. So someone asked, I've been told I shouldn't have rice since my blood sugar is on the higher side. Do I have to give up rice completely? Also, is there a certain level of carbs you can have in a day?
Yes, actually, your carb content is still about 50%, even in the best diets, most diets. The issue is what carbs. If you're having refined carbohydrates, it's a problem. Yes, if you're having white rice as your main staple, it's definitely an issue because it will get absorbed faster. You can't avoid that. It has a high glycemic index, which means it goes up fast and comes down fast, but it goes up. That spike is there. So white rice, okay. How should we have rice? Because if you're a rice eater, you can't just. One is better to have brown rice, better to have other kinds of rice, more like gruel rather than the khila hua, the white rice, the basmati that we think is very healthy. It's not. The other thing is why are so many rice eating countries healthy, whereas Indian rice eaters are worried about blood glucose with this thing. Like take the example of Southeast Asia, take the example of Japan. Healthiest diet is Japanese, but it's rice-based diet.
But their quantity and
Yes,
portion
absolutely
sizes
understand. So the portion size of the rice part is very small there, and is full of veggies around that or fish or something. In India, even regular fish eating, population or regular, meat eating population, vegetable everyone eats. The the rice is like a full chunk, and then you keep adding dal to it and having it. So the amount of carbohydrate that we consume is not okay. So yes, you can have rice in small amounts with lots of veggies. If you have it with lots of veggies, then you're certainly going to see that the absorption is slower, right? And of course, if you can try other kinds of rice, it's even better.
So just another reminder for anyone who's just joined us, I'm sitting here with Dr. Ambrish Mithal. He's the head of endocrinology and diabetology at Max Hospital, Delhi. And if you have any questions for him related to diabetes, please leave it in the comment box and we'll take them during the course of this session. And we have another question from the comment box, actually. Can anxiety be a trigger for diabetes? This is interesting.
I think it's a very important question. See, modern lives are stressful. Like modern urban lives are full of anxiety and stress for many people. Yes, stress can impact diabetes. It really doesn't cause diabetes. I'm talking of mental stress and anxiety here. Mental stress and anxiety is unlikely to be a primary cause for developing diabetes, but it's an important cause for poor control. How does it cause poor control? If you're anxious, think of the lifestyle things we mentioned. If you're anxious, your diet is very difficult to maintain. If you're either depressed or anxious or stressed, you won't feel like eating someday, you'll feel like eating someday, feel like having some of you may be having comfort food when you're anxious, just stuffing yourself. So that is number one. Number two, exercise becomes harder. Number three, per se, anxiety and stress releases certain hormones in the body that raise our blood sugar. So yes, stress can be an important cause, anxiety can be an important cause of uncontrolled sugar. But those who are stressed and anxious, if they are also controlling their diet, despite being stressed and anxious, and are physically active, then the impact is much less. Yeah.
So someone else asked, at what age can you say that now I can't get diabetes? So I think they're asking, is there an upper limit to, if I had to get it, I would have gotten it by now, and now I won't?
So most people with diabetes will sort of have gotten it by their 60s. Once you're beyond that, you'll not get the typical diabetes, but above 70 also diabetes happens, above 80 also happens, but that is called MARD, mild age-related diabetes. So that is not difficult to manage, and it's, but there is no age that is exempt. Anybody at any age can develop diabetes. So even older people can develop diabetes, but if they've been healthy throughout and they've developed diabetes in the 70s or 80s, that's likely to be mild diabetes, which is easily managed.
Another question from the YouTube comment section. If someone wants to reduce their sugar intake drastically, what's the best way to do it? For example, if I eat chocolates by the handful daily and I want to stop.
I think the best way is to do it in a graded manner. Going cold turkey is a bit of a challenge. So best way to do it is in a graded manner. If there's just chocolates, then you can try, if you're having 4 pieces of chocolate, just make it a rule that will not go above 3. For a week you do that, then try and make it 2. Substitute it by, if you're not a diabetic especially, substitute it by a fruit, half a fruit, or gradually take it away. The major thing about sugar de-addiction is that it has to be done over a period of time, stepwise. And the moment you're without that, you will actually, your sweet tooth will also go down. Your craving for sweets goes down. The more you have sweets, the more you want to have them. So you have to sort of break that at some point. Having said that, there are patients of mine and people who say, no, I'd rather just stop it in one go and go with it. So if you can manage to stay off directly for a couple of weeks, it's very likely you'll be able to stay off it.
But like for someone who is very fond of sweets, especially craves sweets, it comes down to impulse control also a
Yes,
little bit.
of
Like
course.
you were saying, it becomes almost like an addictive
Yes,
behavior,
yes,
right?
yes, yes,
So I guess it's like a slow process, step by
Yes,
step
yes.
process to get over it. Okay, let's see if we have more questions. Oh, yeah, we have some questions about gestational diabetes.
Yes.
First is it safe for diabetics to get pregnant? So maybe we can go to the next question once you answer.
So yes, of course, we have two types of diabetes. One is type 1 diabetes, which occurs predominantly in children. Certainly, people with type 1 diabetes have a slightly more difficult time than the other ones. Type 1 diabetes means those who are on insulin all the time, those who require insulin for survival, right? So they have to be very well controlled before they become pregnant. And the insulin has to be controlled throughout with intense monitoring. So that's important. The same holds true for type 2, except that they are usually not on insulin at that stage, and they're probably on metformin or something like that. And if they are well controlled and they plan a pregnancy in consultation with their doctor, we've carried through so many people with diabetes through their pregnancy. So, but during pregnancy, the blood sugar does go up. During pregnancy, very strict control is required, sometimes even continuous monitoring of glucose. But if you follow the rules, follow advice, uh, it's very much possible.
And are there any tests that you can do beforehand to know whether you're in the safe zone, whether you can get pregnant?
Yes, obviously, when you the
Or
main
even
thing
for
is
non-diabetics, if you will be at risk of having gestational diabetes, is there a test to know that?
so there are two things. One is if you're a diabetic, you must control your blood glucose. That means the numbers have to be really good, like fastings of 1995, postprandials of less than 140, 150. If you are a diabetic, as I said, you must check your HbA1c, and it should be close to 6, maybe between 6 to 6.5. I would say the closer you are to 6, the better it is to plan a pregnancy. That's to me. So if you're not a diabetic and you want to know what is my risk of developing gestational diabetes, uh, that's a very important question, because gestational diabetes is very high in our country, very, very high. And some studies have shown 20% or more women may have gestational diabetes. Who is at risk? Those who are overweight. Women who are overweight are clearly at greater risk of developing gestational diabetes. Those who have a family history of diabetes. Those who are already in the pre-diabetic zone on testing. Those who have a history of polycystic ovarian disease. So all these people, and the past history of gestational diabetes, etc., past history of large size babies, but these are the main groups that need to be super cautious. Take proper antenatal care. Make sure that pre-pregnancy they are very well controlled. All the parameters are okay, and then plan.
So we have one more question from the chat box. He asks, how long once you get diabetes will complications start? So I think they mean serious complications.
Yes. So we know that the complications of diabetes involve the eyes, involve the nerves, involve the kidney, involve the heart. And now we know they also involve the liver and possibly even the bones. So a lot of it is dependent on the duration of diabetes. While neuropathy can occur quite early, but complications like eye and kidney are exceedingly rare before 5 years and typically happen only after 10 to 15 years of diabetes. Heart is different because heart is a combination of diabetes and other risk factors. Typically, it's not just diabetes. So yes, in general, complications start after 10 years of diabetes. But sometimes, there can be variations in that. So, and the longer the duration, the more the chances. Having said that, we have enough patients who've been diabetics for 50 years, 40 years, have managed their sugars well, and have no complications or minimal complications. So it's very much possible to lead a complication-free life with diabetes.
While we wait for more questions, I want to circle back to pre-diabetes, which you mentioned right at the beginning. What are how do you know if you are pre-diabetic? And also, once you know that you are pre-diabetic, is there a way to reverse it? Is there a way to go back to normal and kind of fix your high blood sugar?
So I think the numbers for pre-diabetes are as follows. If your fasting is between 100 and 125, or your post-glucose is between 140 and 199, you would be called pre-diabetic. Now, pre-diabetes is at least as common as diabetes, probably more. Okay. So if we say that, 30% of people in this area or 20% have diabetes, let's say 20% have diabetes, then maybe 30% have pre-diabetes. So it's very, very common. How does it matter? Who cares if you have pre-diabetes? I have no symptoms, I'm feeling fine. I think pre-diabetes brings with it certain associations. Number one, of course, the risk of converting to diabetes. And in India, the risk is pretty high. And if 10 years of pre-diabetes, most people will tend to become diabetic. And by 5 years, also a lot of them. So every year, some will convert to diabetes. Some of them can pull themselves back into non-pre-diabetic, a normal zone, depending on how good they are with their diet and exercise. But if we are not really serious and making an effort, you will definitely go down that slope.
And what about people who have already crossed that, threshold and reached the diabetic stage? Can they reverse their condition?
Yes, they can. So before that, there's one more line that about pre-diabetes, and that is that pre-diabetes also increases the risk of other complications. It's not that there is a exact cutoff at the numbers that I mentioned, 126 and 200. It's somewhat linear. So risks for complications start at much lower level, including cardiac complications. So pre-diabetes is important. Don't get overawed by pre-diabetes. Don't get depressed by pre-diabetes. It is a window of opportunity for you to fix it before it breaks, before it actually becomes a problem. So I think this is very, very important. You were asking me about diabetes per se. So Anushka wants to know what happens if you have diabetes. Can you still reverse it? Some people can reverse diabetes, not all. So, people who are advertising that everyone can reverse their diabetes, they're not right, but some people can. One size does not fit all. Remember this. Now, who can be a potential candidate for remission? We call it remission because reversal means you're probably presuming that is forever. Now, we don't know. We don't know. Yeah. So we don't use the word reversal or cure. We say remission, which means for the moment, at least it's gone out of action. Who are those people? Young patients, young onset, like young age, 30, 35, 25, even 40. But people who just gotten diabetes at a young age, within the first 5 years is the best period to try. And within that also, those who are overweight or obese, where the diabetes is directly coming from their poor lifestyle or weight, if they lose weight, they can reverse the diabetes. There's a lot of data to suggest, remarkable data showing 10% weight loss, for example, can reverse diabetes in a very substantial proportion, depending on the duration, etc., of diabetes, and they can remain like that. And if you go even, if you go on a really low calorie diet, there have been studies with like 800 calorie diets, and there you find again that sometimes, almost 2/3 of people were able to reverse their diabetes. But it's to do that kind of aggressive dieting, you have to be under real supervision of an expert because it can be otherwise dangerous for your nutrition. So again, to repeat, yes, young people with recent onset diabetes should try to reverse diabetes, and it is possible in many of them.
Right. So we've got a bunch of more questions. Meera asked, is it advisable to start on insulin as soon as you're diagnosed with diabetes, or should we try and control as long as possible with medicine?
So what matters in diabetes is the control. It really doesn't matter if you're using insulin or tablets to control it. So if you're talking of type 1 diabetes, I'll keep that aside because their insulin has to be used. There's no option. There's no question. That is a disease of insulin deficiency. The other type 2 diabetes, which is a combination of insulin deficiency and insulin resistance, definitely you can use oral medications. There are lots of choices of medication now. And if they're working well for you, and if your HbA1c, the 3-month average blood sugar, is well controlled, there is no need to jump to insulin. It's not that insulin is good, medicines are bad, or insulin is bad, medicines are good. No, not only that. Some of the newer medicines actually can help reduce the risk of complications. So, SGLT2 inhibitors or GLP-1 receptor agonists, these drugs, they reduce the risk of kidney disease, heart disease, liver disease in people with diabetes. So listen to your doctor. There is no absolute that insulin is better than orals or orals are better than insulin.
One more question about myths. Someone asked, does having jamun or other fruits aid in controlling diabetes, or are these just myths?
So, jamun is a good fruit for people with diabetes. There's no doubt about that. But whether it really lowers the sugar is a question mark. But it's good because it has other properties. It doesn't raise the sugar much. People have used jamun powder and other things, People try that. If at all it does that, it may be a few milligrams here and there. It cannot be primary treatment for your diabetes.
Also, someone here has given the blood sugar reading of their mother-in-law and wants to know if it's normal. So HB1AC 3.6. Is it
How
normal? HB1AC.
Yeah, is
6.3. Is it normal
6.3
for a 60-plus-year-old woman?
So it's not right to say it's normal. It's clearly in the pre-diabetes zone. When we spoke about, I'm glad she asked this question. When we spoke about pre-diabetes, I did not mention HbA1c range. If you're between 5.7 and 6.4 HbA1c, that is pre-diabetes, right? So many people nowadays do HbA1c like she's talking about. I should have explained that at that point also. Anyway, so 6.3 means she's close to being diabetic. So she cannot be classified as normal. She's 60 plus. It's very common to have this kind of value. It's a good time to get a hold of everything, her diet, her exercise, and try and bring her back. There is no need to panic. But yes, it's hard for me to say that it's a normal reading.
Okay. Someone else wants to know. Hi, sir. 2 previous generations of my family have been diagnosed with diabetes. How at risk am I?
Well, 2 previous generations have had diabetes. You're obviously at very high risk. I mean, typically the risk for diabetes, even if one parent is diabetic, is at least 50%. And if both are diabetic, then it crosses 70, 75%. So in India, I think everyone is at risk for diabetes. And if you come from a family where 2 generations have had it, I think it's good to take precautions, which is not very difficult. Maintain an ideal body weight, you look good, exercise regularly, eat healthy, and you'll prevent diabetes.
I have a follow-up question on this as well, because I've heard people say diabetes skips a generation, or if your father has diabetes and you're a girl, then it's less likely to get to you, and stuff like that. Is that true?
So there were a lot of such theories that were floating around 30 years ago, but there's nothing like that. Nothing like that. In fact, if your father has diabetes, you have a pretty good chance of getting it. So it doesn't skip a generation, no.
Okay, we have another question. What changes one can do in their day-to-day routine to manage diabetes? I think you already went over this. Let's see. Okay, someone else has asked, sir, can you highlight on high insulin resistance of 8.3 in type 2 diabetic? What is the normal range?
So the numbers for insulin resistance are all very controversial and very sort of nebulous. I'm not going to go into the numbers, but if you have insulin resistance, then everyone with type 2 diabetes, at the beginning especially, have insulin resistance, and there's no question. So in fact, insulin resistance often predates the onset of insulin deficiency. And when you have pre-diabetes in that zone also, you have significant insulin resistance. So don't chase the numbers for insulin resistance, chase your glucose numbers and chase your baseline. That is important. So don't worry about the number there for insulin resistance.
This is an interesting question. Someone has asked, this is a hypothetical question, but when you constantly tell a diabetic person to take care of their diet and weight and calorie intake, is there a risk of developing an eating disorder?
So I don't think that people develop eating disorders because we tell them to do a certain thing. I wish they would do 50% of what was advised. That would solve all our problems, much of our problems. But I think eating disorders are intrinsic there. They're problems of the mind. They're not uncommon. We used to think they're uncommon in India, but they're not uncommon. And you may have, even anorexia nervosa or binge eating and all those things. So I don't think that advice can lead you to an eating disorder. It's your personality, and you have to work on that to avoid getting into that state.
Also, do diabetics need to double check with doctors before taking over-the-counter medicines like paracetamol?
If you're a diabetic but without any kidney involvement, etc., I don't think there's any big difference. In general, we should limit our over-the-counter medication to, like maybe an odd painkiller, or odd cold medicine or something. But otherwise, I don't think we should go too much over the counter. But there's no specific guidance for people with diabetes per se.
So we've got another question related to eating disorders. Someone has asked, there's an eating disorder, binge eating, which you also just mentioned, which is primarily a psychological condition. Are people who binge eat at a higher risk of diabetes? How are such cases typically dealt with?
So it's not a great space to be in, It can be managed, but needs a lot of help from a psychiatrist. So you have to do yes, people who binge eat, if they put on weight, they will be at risk for diabetes, obviously. So that has to be addressed. You have to address the diabetes, and you have to address the binge eating problem. And for diabetes also, there you'll try and use medication that helps suppress appetite. You can do all those things, but it's a concerted effort and can be quite challenging at times, because such people also will not eat, or they will throw up sometimes forcefully. So then you don't know how to adjust the medication. It's very difficult. So proper psychiatry treatment is very, very important.
So this is another interesting thing. A lot of the times you have related illnesses, related ailments, and you need like a group or team of doctors to work with you together, right? It's not just an isolated thing. Right. So we've been getting a lot of questions about how often one should check their blood sugar. If you have type 2 diabetes, do you need to check it every day, or how often?
So, we cannot put all people with diabetes in one basket. So there is a whole range of advice that we give. If someone is just on diet advice and not even taking medication, maybe we'll say check once or twice a month. Get your HbA1c done after 3 months. If someone is on basic medication like metformin or gliptins, again, we might do that. If one is on medication that can lower the blood sugar, then we need much more frequent testing. Daily, maybe sometimes twice a day, right? It really depends on how you're looking at it. It also depends on where you are with your blood sugar. If you're at an HbA1c of 7.2 and are trying to bring it to 7, and you're on very basic medication, you don't need that much testing. But if you're at an HbA1c of 12 or 13 with blood sugars of 400, the doctor will advise you to test 3-4 times a day. So it depends on the situation. But a typical type 2 diabetic in the early stages of disease does not need too much testing either. If you do it even once a week, that is good enough.
And one more question from the YouTube comment section. Sir, diabetes insipidus, I think that's how you pronounce it.
Insipidus, yes.
Can be reversed also?
So we moved on to another kind of diabetes. The diabetes mellitus is sweet urine. Diabetes insipidus is tasteless urine, insipid urine, right? So that is nothing to do with the diabetes you're talking about. Diabetes insipidus is a condition where you pass a lot of urine, lots of dilute urine, and drink tons of water to match up to that. So it's like a thirst and urine disorder. So there is a definite reason in the pituitary gland or above that. It's not reversible by any it's not a lifestyle disease at all. It has to be treated with medication, with hormones, and the cause has to be fixed. So there's no question of reversal, unless it's a post-surgery diabetes insipidus, which reverses on its own, that's possible. But it's a totally different disease, nothing to do with diabetes.
Similarly, does gestational diabetes in someone who didn't have it before also go away on its own after pregnancy?
I think that's a great question because there's a lot of work in that area. Yes, in most people, it will go away after delivery, but it almost always comes back. We think gestational diabetes is almost certainly a marker of future diabetes. And if anyone who's had gestational diabetes would be at great risk of developing diabetes and should always be careful. See, what happens is pregnant women are very careful when they are pregnant because they're worried about themselves and their baby. And the moment that is over, then they're sometimes overfed or they become careless, or because someone tells them during lactation you have to eat and eat and eat. So they all put on weight. And then the risk for diabetes exponentially increases. So if you're able to manage your weight, manage your diet post-delivery, you're reducing your risk. But yes, gestational diabetes is a marker of future diabetes.
Okay. Another question someone else has asked is, Doctor, what amount of blood sugar can be considered as safe for a 30-year-old male? How will we know if one is vulnerable or not?
So I guess we've answered this more or less. The normal blood glucose range we know, and that would be considered safe. And the vulnerability is the same as in women, which means if you have a family history, if you are overweight or obese, if your BMI is above 23, for example, waist circumference of a man is over 90 centimeters, if you are sedentary, not sleeping well, yes. If you ask me, what is a single factor that will predispose you to diabetes? It's your body weight. Weight propels us towards diabetes. Many people, I'm surprised, even now in my opinion, don't really understand the connection between weight and diabetes. So if we were able to have everyone ideal body weight, much of type 2 diabetes would disappear. So that's the main message.
Also, this is something that one of our readers has asked, and also I'm curious about this as well. What to do immediately if your blood sugar spikes? So when your blood sugar goes down, we know what to do to bring it back up, but is there a way to bring it back down if it spikes?
So firstly, the odd spike in blood glucose, a sudden rise is not, you shouldn't get too hassled by it. Trying to do too much to bring it down will only create more trouble. I mean, unless you're pregnant or unless you're in a situation where you really have to do that. The only way to bring blood sugar down fast is to use insulin, fast-acting insulin. So people get very hassled by one or two spikes. No, that's not a concern. But if the spike is happening daily or frequently, you need to ask your doctor to adjust your medication. But at that point, should you be doing something immediately? The blood sugar reaches 300, should I immediately take something? No, I don't think there's any evidence for that. You should let it be.
Also, this is an interesting question. Youngsters are hesitant to share that they are diabetic in their workplace. Why is there a stigma around this, especially if you're diagnosed at a younger age? Is this something you come across among your patients?
I think a lot, actually. Despite diabetes being so common, I'm amazed that people are still very wary of being told that they are diabetic. And especially with type 1 diabetes, there is a clear stigma, which means that people have to take insulin to survive, carry their insulin to office, keep it in the refrigerator, use it during lunchtime. Yes, it is right. You're right that there is some kind of stigma which should not be there. There is no logic. There is less stigma with type 2 diabetes, but with type 1, it's just that as a society, we're only maturing, we're only growing, we're only developing. As understanding improves, these things keep changing. But at the moment, unfortunately, most people still attach a stigma. We worked with schools, we worked with other groups to try and remove that. So it has definitely declined in the more aware environments. But still, there will be people, yes, who will sort of look down upon you. And people who have that condition are very sensitive. And sometimes colleagues may mean no harm, but they may not be that sensitive to the condition. So one has to be a little careful about that. And we should all work together to try and reduce the stigma. That is a subject very close to my heart. There should really be no stigma attached to diabetes. Of course, type 2 diabetes, but even to type 1 diabetes, and my children with type 1 diabetes should not be stigmatized at all.
So we'll have to wrap it up soon, but I just want to ask a couple more questions before we do. Someone has asked, what are some symptoms of diabetes that can be missed easily, and how does one keep a check on them?
So the problem with diabetes is that it doesn't produce symptoms in the early stages. So most people with diabetes are picked up because they went for a health check or they went to the doctor or something else, and they just checked the sugar and found. But otherwise, of course, we know the classic symptoms are excessive thirst, excessive urination, weight loss. Those are important symptoms. Other symptoms can be just fatigue, fatigue, calf pain. People don't relate that with anything. So I would certainly check a blood glucose if anything that is making me feel out of sorts, somewhat different, some maybe weight loss, maybe tired all the time. It's good to check your blood glucose. Otherwise, we should screen everybody for diabetes periodically. Definitely those above 30, I think even 25, and sometimes with family history, even at 20. And if you're obese and have family history, maybe even earlier than that. So you should screen annually. It doesn't require much. You can do a single blood test. I think it's a good idea. Don't wait for symptoms. Developing symptoms means that you're already reaching that stage when sugars are quite high.
Also, someone wants to know, does uremia, can uremia be treated and managed just with dialysis? I'm completely clueless about
uremia. Okay, uremia is chronic kidney disease, kidney failure. It's also called end-stage renal disease, which means that the kidneys have really packed up. And yes, at that stage, you can either go for maintenance dialysis, or preferably, if you're in the right age group and everything, is to go for a kidney transplant. Both are good options, but a transplant is a longer term option. Maintenance dialysis stops at some point or the other. However, the improvement in dialysis facilities in our country, I have seen this dramatic change in survival of people with uremia. And now people are living many, many years without any problem. And of course, the transplant programs across the country have taken off in a big way. We have excellent nephrologists and skilled surgeons, and our patients are living much longer than they used to. So either way, dialysis or transplant, make sure you go to an expert, a good center, and get good care.
And the last question before we wrap it up, which type of diabetes causes blindness? Are all diabetics prone to blindness?
Yeah, I hate using words like blindness, but it's true. Eye complications in diabetes are a serious concern. But they're also one of that group of complications that are almost totally preventable. So while, yes, if someone has 25 years of uncontrolled diabetes, the retina gets involved, plus so many other things happen. Glaucoma may be there. All those combined can lead to actual blindness. That's what you're saying. It could be type 1 diabetes or type 2 diabetes. It doesn't matter. All kinds of diabetes can do that. The key in that is to control your blood glucose. If you are successful in controlling your glucose, if you paid attention to it in the initial stages, when you didn't have symptoms, you would not get into that zone at all.
Right. I was going to end it there, but we have one more question that I really want you to answer. So we'll just take this and then wind up. Does daily running reduce the risk of diabetes?
Daily running is a great exercise. So if you're a jogger or a runner, please go ahead. Keep that going, because exercise is a very important way to protect yourself from diabetes. It may not be alone, it may not be enough sometimes, depending on your risk level. But yes, it's definitely a significant factor in keeping diabetes at bay.
Well, thank you so much for joining us today, Dr. Mithal. This has been very enlightening, and I hope our audience has also found it very helpful. Before we leave, though, I just want to plug our campaign once again. We have been doing a lot of stories related to diabetes from the perspective of people who have diabetes, those who care for diabetes, doctors like Dr. Mithal right here, and also nutritionists. So please do go check them out on our website. And yeah, I think we can wrap it up here.
Well, thank you very much, Anushka, for inviting me here. It's been great. You have great audience who are very interested and very smart questions, I must say. So it's been a pleasure. Thank you.